Hello, my dear friends and my dear colleagues and my fans everywhere. How are you doing? I hope that all of you are doing well. Today I will talk about, as a continuation of my previous episodes about abdominal pain, acute abdomen and chronic recurrent abdominal pain. I will continue talking about an important issue related to my last presentation yesterday. It was a long presentation regarding abdominal pain in clinical practice. Today I will speak about what we call rare or uncommon causes of acute abdomen. Rare or uncommon causes of acute abdominal pain, but the clinician who are prepared to diagnose such cases and manage such patients should always bear in mind, and it should be kept at the back of the mind as rare causes or uncommon causes which we should think about when we are facing a case of acute abdominal pain. These uncommon causes are, number one, what we call epiploical or epiploic appendagitis, and appendagitis is related to the epiploic appendages or appendices epiploicae, in other words. Appendices epiploicae, these are protrusions of adipose tissue or fatty tissue which arise from the serosa of the colon. They are small serosal protrusions formed of fat. And such protrusions, they might get inflamed by an inflammatory process or due to venous outflow thrombosis or occlusion causing infarction or necrosis of such epiploicae, and so it presents clinically with abdominal pain or acute abdomen, same like appendicitis on the right side or diverticulitis on the left side. So they should be put into the differential diagnosis because commonly they arise from the sigmoid colon, so they might be presenting with acute left lower abdominal pain because they arise mostly from the sigmoid colon, but it can also present on the left side in relation to the ascending colon. So because these epiploicae or appendages epiploicae or appendices epiploicae or epiploic appendages, these fatty occlusions, they anywhere in the abdomen, they arise from the colon, as I mentioned, the serosa of the colon. This is in the anatomy, revised anatomy of the colon. So when these epiploic appendages or appendices epiploicae, they get inflamed or they get infarcted or necrosed, they present with abdominal pain due to inflammation and swelling and the edema of the colon and the covering peritoneal membrane. So we get an acute abdomen also. This should be recognized. Because it should be recognized early and treated early, and should not be misdiagnosed with acute appendicitis, whether obstructive or non-obstructive, and should not be misperceived or misdiagnosed with diverticulitis on the left side of the abdomen as a cause of acute abdominal pain. So this is very important. Number one. This number two, we have also omental infarctions. And omental infarctions are usually related to vascular occlusions. Omental infarction. Omental infarction is another rare cause of, this omental infarction might be related to vascular occlusion of the blood vessels of the omentum, whether the lesser omentum or the greater omentum. Omental infarction might also present with abdominal pain. Omental infarction related to the omentum, part of the peritoneum. Number three, what we call mesenteric panniculitis. And mesenteric panniculitis might be an autoimmune disease or autoimmune inflammation, or maybe related to disturbance of the immune system with inflammation of the panniculum of the mesentery, so we call it mesenteric panniculitis. Mesenteric panniculitis is also a broad spectrum of pathological disorders, although rare, but it has a spectrum of pathology and spectrum of presentation, and this mesenteric panniculitis of whatever underlying pathology, whether autoimmune or non-autoimmune or drug-related, that's medication-related, chemical-related, or toxin-related, we should identify it, and we should not forget that it might be one of the causes of abdominal pain, and one of its clinical presentation features is abdominal pain. So mesenteric panniculitis. Don't forget mesenteric panniculitis. And it has also a special approach and special management in clinical practice. Another pathology as a rare cause is the superior mesenteric vein occlusion and occlusion of its entry into the portal vein, because we know that it passes and it drains after that into the portal vein, the portal circulation, which supplies the liver. So superior mesenteric vein occlusion by whatever underlying pathology, by localized factors or factors related to hypercoagulability and increased thrombotic tendency, or due to slowing or due to compression of the superior mesenteric vein by local factors, by swelling outside or by mural problems or extramural problems, or from inside the vein itself, as I mentioned, in hypercoagulability states and thrombotic syndromes. And one of the sites of thrombosis is thrombosis of the superior mesenteric vein. Superior mesenteric vein, so thrombosis and occlusion, it might also cause subacute or acute abdominal pain. So superior mesenteric vein occlusion. Also, right ovarian dermoid cyst torsion, and this is a rare gynecologic cause of acute abdomen. And as I mentioned yesterday, in a female or in a girl or in a woman presenting with acute abdomen, we should think about medical and surgical and gynecologic causes. So don't forget gynecologic causes related to pathology in the reproductive organs in females as a cause of acute abdominal pain, especially with patients presenting with acute lower abdominal pain or pelvic pain. Related pathology related to the reproductive organs, to the ovary, to the fallopian tubes, to the upper part of the uterus, or to the pelvis itself, because this might be the source of acute abdomen or acute abdominal pain. One of the rare causes is torsion of an ovarian dermoid cyst causing acute lower abdominal pain. Also, pelvic inflammatory disease is a rare but an identifiable cause and a recognizable cause of acute lower abdominal pain in females associated with other gynecologic symptoms and signs. So pelvic inflammatory disease, torsion of right ovarian cyst, especially dermoid cyst, is also a rare or uncommon gynecologic cause of acute abdomen in females. Another uncommon cause is superior mesenteric artery occlusion, also related to atherosclerosis or related to hypercoagulability and stasis of blood in the superior mesenteric artery. Most commonly in patients with hyperviscosity syndromes and hypercoagulability and increased thrombotic tendency. The superior mesenteric artery may be occluded acutely or acute on chronic, and in both cases with acute obstruction or acute on chronic obstruction, it might present with acute abdominal pain, superior mesenteric artery. And this is one of the vascular causes and is considered a surgical and medical cause at the same time. So it is one of the medical and surgical vascular causes of acute abdomen. So don't forget the vascular, and don't forget the superior mesenteric artery occlusion, don't forget the superior mesenteric vein occlusion as rare causes of acute abdominal pain. Also, another rare cause or uncommon cause is gallstone ileus. That is ileus related to a gallstone disease and movement of the gallstone in the gallbladder into the biliary tree, and they might cause ileus and perforation and then ileus of the small bowel. And this might also present with an abdominal pain. So don't forget this also as a rare and uncommon causes of acute abdomen. Also among the rare causes is lumps of parasites like ascaris, for example. If there is occlusion of the bowel, and this might be a rare cause, reported cases of acute intestinal obstruction by a parasitic lump containing ascaris worms. Although rare, but it might happen, especially in endemic countries in which such parasitic infestations are common. So don't forget ascaris and other parasitic infestations as causes of acute abdomen, and they cause acute abdominal pain by different mechanisms, by perforation, by obstruction, by inducing inflammation, acute inflammatory processes. There are different mechanisms of acute abdomen due to parasitic disease, especially parasites involving the gut. And I mentioned one of them is the Ascaris lumbricoides, and also as a nematode. And also we have hookworm infections, especially ankylostoma duodenale. They might also, ankylostoma, present with acute abdominal pain with iron deficiency anemia due to bleeding. In addition, associated with other abdominal symptoms of vomiting, nausea, loss of appetite, diarrhea. Ascaris and ankylostoma are common parasites. In addition to, as I mentioned yesterday, Giardia and amoebic colitis, they are common parasitic diseases causing acute abdomen. Some specific infections, chronic infections like malaria, it is one of the causes of abdominal pain, and I will talk about malaria and abdominal pain in a separate presentation. And abdominal pain in malaria is multifactorial and with different mechanisms, but it's more common in patients with malignant malaria, that is falciparum, Plasmodium falciparum malaria, and especially with serious complicated cases, what we call complicated malaria. And this is usually related to Plasmodium falciparum, which is, we call it sometimes malignant malaria. And one of its ultimate gastrointestinal manifestations is gastrointestinal symptoms with severe abdominal pain related to sequestration of red blood cells in the vessels and or acute hemolytic process. And it might present with acute abdomen, especially with nausea and vomiting, and also sometimes with diarrhea. And this is, we call it gastrointestinal malaria, acute gastrointestinal syndrome related to a falciparum infection, presenting with acute abdomen and or vomiting and diarrhea. Although other cases of malaria due to benign tertian and quartan malarias related to Plasmodium vivax and Plasmodium ovale and Plasmodium malaria, they might also produce abdominal pain, but abdominal pain in benign malaria is much less common and usually mild and transient. But in falciparum, it might present with acute severe abdominal pain with other gut manifestations, upper and lower, vomiting, especially vomiting, and diarrhea, and maybe also bloody diarrhea in severe Plasmodium falciparum infections. This is the complicated or malignant malaria. So this abdominal pain is also the common parasitic protozoal disease, which is malaria, which is an endemic disease in many parts of the world and dangerous disease. Of course, we know it is transmitted by mosquitoes. And it is a dangerous parasite. It is a dangerous protozoa. Might present with acute abdomen also. So consider it in countries endemic in which malaria is endemic. So these are rare causes of acute abdomen, depending on the underlying situation, vascular infections, specific pathologic conditions. These are rare or are uncommon causes of acute abdomen, or in less serious cases, subacute abdominal pain might be the presentation. So whether acute or subacute, we should consider such uncommon pathologies in special situations, and the clinician should put them in the back of his or her mind when facing a case with acute abdomen. Don't always think about appendicitis and diverticulitis and cholecystitis and pancreatitis and forget the other pathologies, the multiple and the wide range of pathologies, which the common and rare, the serious and less serious, which might be the cause of acute abdominal pain or subacute abdominal pain. Less serious causes of acute abdomen, also less serious causes and unusual causes of acute abdomen, and they are usually mild to treat. We have the irritable bowel syndrome, we have the constipation. Constipation itself might present with subacute, usually subacute abdominal pain or just abdominal discomfort. So discomfort, abdominal discomfort related to chronic constipation or acute constipation. But the constipation may be an associated symptom denoting pathology. So the constipation may be the cause or may be an association. depending on the underlying pathology in the specific individual case presenting with abdominal pain. So there is a link between constipation and abdominal pain in both ways. As an association or as a cause and result, it depends on the case and the underlying pathology in every particular case or every particular individual. So constipation, irritable bowel syndrome, gas, flatulence, food intolerance and food allergy and food intolerance and food poisoning. So food, of course, is related to acute abdomen in a variety of ways as a part of the food intolerance or as a part of the food allergy or as a part of food poisoning. And here there will be associated other abdominal manifestations like vomiting, like diarrhea, like bloating, depending on the case. So food intolerance, food allergy, and food poisoning. Other specific, more specific entities related to food, we have lactose intolerance. It also might present with abdominal pain, and gluten intolerance in specific situations. And these are genetic disorders related to inability of the body to deal with specific type of foods or food ingredients or food constituents, and they cause also gut symptoms or abdominal symptoms to human individuals. So these are also unusual, less common cases of abdominal pain we should think about. More serious causes of abdominal pain we should think about because they need an urgent attention or emergency medical care, and the individual should ask for emergency medical care, is related to rupture of organs, perforation of organs, rupture of hollow viscous or rupture of solid organ, especially in relation to traumatic abdominal problems. That's abdominal trauma, and as I mentioned before, traumatic causes is one of the causes of acute abdomen as a surgical category of diseases causing acute abdominal trauma with ruptured liver, ruptured spleen, or intraperitoneal bleeding related to body trauma. This is serious, and also rupture of vascular structures in the abdomen, like rupture aortic aneurysm or acute abdominal aortic dissection, acute dissection of the abdominal aorta. It might be also more serious and rare cause of acute abdomen. Same like the section of the aorta in the chest as one of the causes of acute chest pain, which is considered in the differential diagnosis of acute MI. We have to differentiate between acute MI and acute aortic dissection as two important life-threatening conditions, the causes of acute chest pain of cardiovascular origin, acute MI versus aortic dissection. Also, abdominal dissection in the abdomen might be cause of acute abdomen, same like thoracic dissection, a cause of an acute chest pain. These are serious conditions which also should be considered, and they are usually surgical. The surgical causes are usually more serious, and they are more life-threatening, and the physician dealing with in the emergency room or the acute medical care or in the primary care facing and dealing with acute abdomen should always think about such issues. The last thing I want to talk about is after thorough history taking and after physical examination, which are mandatory and essential first and second steps in the clinical evaluation of a patient presenting with acute abdominal pain, we have to do investigations, and after investigations, most important investigation is complete blood picture and ESR, because it gives clues to many things and to the underlying pathology in many cases, in surgical and in medical and in gynecologic, even gynecologic causes of acute abdomen. Blood picture is very important, electrolytes very important, biomarkers very important, serum trypsin and serum lipase if the case is suspected of pancreatitis, liver functions if the case suspected of hepatitis or hepatobiliary, liver function test, bilirubin, enzymes, hepatic enzymes, this is very important, urine examination and the kidney functions if there is suspicion of urinary stones. So we have also to do this. And then we move to investigations, and the most important radiologic investigations after the laboratory investigations. After studying the chemistry and the hematology, we have to move to radiology. And the most important primary diagnostic radiologic tools is a plain radiograph of the abdomen and the abdominal ultrasound, standard abdominal ultrasound. This is very important primary tools in the diagnosis of many causes, surgical and medical, of acute abdomen. So abdominal ultrasound. After abdominal ultrasound and plain radiograph of the abdomen, we might also need barium studies, that is X-ray with barium enema for the upper gut, or X-ray with barium enema for the lower gut, and barium meal for the and swallow for the upper gastrointestinal tract diseases. And then we proceed to more sophisticated diagnostic radiologic investigations like CT scan, with and without contrast, or without and with contrast. That's contrast enhanced CT scan of the abdomen, so CT abdominal scan. And then if not conclusive, we can also ask for MRI abdominal scan or abdominal MRI scan, which also might detect the pathology. We might need more sophisticated also techniques like duplex ultrasound for detection of vascular problems related to the celiac artery or supramesenteric artery, or angiography, or CT angio also. These are mandatory if we are suspecting vascular causes of abdominal pain. So duplex ultrasound and CT angio are important, or conventional angiography. These are radiologic investigations which we might ask for when we are evaluating a case presenting with acute abdomen. Of course, in addition to other investigations like endoscopy, which might help also, and also transendoscopic ultrasound, and upper endoscopy and lower endoscopy if we are suspecting tumors, if we are suspecting pathology, if we are suspecting inflammatory disease of the bowel, like in ulcerative colitis and the Crohn's disease. And I mentioned them yesterday because they are among the inflammatory inflammatory medical causes of acute abdomen, inflammatory bowel disease. And here we might need endoscopy and biopsy, whether in Crohn's disease or in ulcerative colitis. Thank you so much, and I will see you in other presentations. Don't forget how to approach the acute abdomen, and don't forget the rare and uncommon causes of acute abdomen. Thank you so much, and have a nice day.